My name is Amy Jackson, Deputy Director of Transformation Integration for West Essex Healthcare Partnership, working with a joint role under Essex County Council and Herts and West Essex ICB.
I'm Caroline Brannan, Director of Clinical Integration at St Clair Hospice.
My name's Leanne Miles and I am a manager at Bearing Point. I work as part of the Government and Public Sector team and I take a leading role for health and social care.
So my role is helping West Essex Healthcare Partnership to achieve its ambition and to improve our outcomes for our population, not just short term but over the longer term, and looking at those wider determinants of health, but also those opportunities for joint commissioning. And that's what my role allows, working across local authority and health to find those opportunities, build relationships and improve our joint outcomes. We asked Bearing Point to come in using their expertise of working across health and social care to truly understand our demand, but from the perspective of the person. We wanted them to embed themselves into our organisation and understand all those touch points that individuals have with our system across the intermediate care services. They did that by working closely with our services, but really understanding the patients and looking at their journey through our system.
So there was a few objectives to work with Bearing Point, and we jumped at the chance really because we work alongside Herts and West Essex ICB. Again, try to work in real partnership with them because we want to align with the work that's done and look forward to the next 10 years about the care that needs to be provided.
Bearing Point already had an established relationship with West Essex. We'd worked with them across the system for the last 4 years, which meant that we were able in this project to really build upon work that we'd already done. So we deployed a number of tools and techniques, and that included gathering 300,000 lines of data. It included interviews with senior leaders and with patients themselves, spending time at touch points, and we brought all of that information together and triangulated it in order to get a view of the intermediate care system through the eyes of the patient. So the outcomes of the projects were twofold. So there were some tangible things. So we provided a leaders report, contained all of the information, the data and the findings. That was something we could leave with the leaders and that they could use going forward. In addition, we held a leaders workshop where we were able to come together, look at the outcomes and really think about the opportunity that it presented. The outcome that was less tangible, but definitely has been felt across the system as they feed back to us, is the different way of thinking, the being able to see the world through a different lens, not seeing it through the lens anymore of silos and services, but seeing it through the lens of the adult and through the patient lens. And so I think that's one of the biggest outcomes is the desire and the drive for change.
The recommendations from Bearing Point are already playing out in the transformation activity that we are doing. We've developed a proactive care model with our integrated neighbourhood teams, and the recommendation from the Bearing Point work is applied in those principles in terms of understanding the true need of the adult, building our plans around the individuals rather than prescribing solutions, and then continuously improving that and working with the adult to meet their needs and their outcomes.
Bearing Point delivered something in my mind really quite new and innovative, but incredibly sensible. So it wasn't maverick, but it was really, really brave. It's helped me be part of a system that promotes integration and person-centred care. It's helped us recognise and understand that actually we do have the resources. We might not think we do, but they are there. I'm working with partners and other providers and other leaders to really champion, rather than asking people to think outside the box, to change the box and to look at it in a different way.
So the great thing about this work is there are no limitations to it, and it can be applied on a huge scale at a strategic level, and it can also be applied at a small scale within a single service or a single pathway. It's an approach, and it can be tailored to any challenge that a health or care or any government and public sector organisation find themselves in, and it really helps to address managing the demand but truly managing it. So enabling organisations to respond to people's needs rather than to process a one-size-fits-all, which actually often drives higher demand.
Working with Bearing Point was a positive experience. We learnt a huge amount from the process and the way in which they embedded themselves into our services. They had real respect from our frontline teams, and what we say now is that the work that Bearing Point have done with us cannot be unseen.
This piece of work shows us that things can be done where we are at the moment. It takes bravery, it takes different thinking, it takes different minds around a table. So what I would really love is for other people to see this piece of work and perhaps start adopting it and adopting the principles of real integration in healthcare delivery.